different options available to replace a missing tooth, like a partial, which gets support from the other teeth. You have to take it out and put it in. It can move, it is not fixed. I don't really recommend that option because over time I have seen patients in which the abutments are affected. So we don't really recommend having partial, but it is one of the options. The other option is a bridge, in which we have to cut down the two neighboring teeth and give you a permanent bridge, so it is fixed, it doesn't move, so you have an option that it doesn't come out, you can enjoy the food better. It is a good procedure to do in some of the cases. And the third way and the latest way to do it is placing implants. So implants, it's titanium, so they're not going to get a cavity if you have lost teeth because you had cavities, so titanium is good. So you don't have to cut other teeth, it's not going to bother other teeth, it's just a single implant. You can replace one tooth with an implant, or you can have multiple implants and replace the entire arch. So implants is the way to go.